Hi, I'm Annie Naylor, and I own the Center for Muscle Therapy here in Scottsdale, Arizona. And I'm here to talk with one of my clients today, a very dear client and friend of mine, Carol, who came to me, Carol, I would say probably about a month ago.
I think so.
And Carol came to me through a couple of other clients of mine that had come to see me and was complaining of a painful problem that was stemming from her hip. And so we're going to talk a little bit about that issue that Carol had and how quickly we were able to resolve it. You want to talk a little bit about that?
Sure. Well, first of all, I heard of Annie through my neighbors. I have two neighbors that had gone to her. The one gentleman that actually gave me her name and gave me one of her cards actually was over by the pool one day, and he was walking with a cane, and I had not seen him with a cane before.
Yeah.
And I said, "What's wrong with your? What's wrong?" And he said, "Oh, I've got this issue with my foot." And I said, "Oh, I'm so sorry." And he said, "Yeah." I said, "But I'm hoping to get it fixed tomorrow because I was referred by another neighbor to this lady." And next time I saw him, which was a couple days later, he didn't have the cane. I said, "Give me this woman's name. I need it badly." So I went to Annie. I had an issue with pain in my left hip for close to 3 years. I had gone to my regular doctor.
Mm-hmm.
I had gone to a
You had gone to an orthopedic. I think you
orthopedic
had been
surgeon.
to a few
Who
specialists.
he sent me to physical therapy. I did that for like 8 weeks.
Mm-hmm.
And
Were you also doing medication with that also?
Oh,
Were they
yeah.
giving you
Heavy
pain
duty,
medications
heavy
and
duty,
things
yeah,
that?
which I hate taking, but I couldn't sleep otherwise.
Yeah.
And and this went on for almost 3 years, and
Wow.
I just couldn't believe that I had to live that way.
Yeah.
I
And this-
just don't believe that anybody has to live with pain.
Yeah. And this is a story that I get often from my clients that come in to see me, because when I go through the process of when I went through the process of treating Carol, as I do with everybody, I try to educate them as much as possible on why they've gotten into the situation that they've gotten into, and to sort of make more sense to them of why they are having the issue. And Carol was saying to me, well, that makes a lot of sense. I'm doing this and I'm very active, and so we want to get to the root issue of why she's having the problem. And so the doctors were talking to her, actually, I think, about having a possible hip replacement at
Well,
some
that's
point.
what I thought I needed, and they said, well, you have a little teeny bit of arthritis, but it's not enough. And excuse me, the orthopedic surgeon said, you just have such good range of motion.
Right.
And he said, if you have that pretty much takes that off the table.
Mm-hmm.
But
it still wasn't getting rid of
Oh
her
my
pain
gosh, no.
situation. And so the medications, and she was in limited range of motion. And Carol's very, very active, doing a lot of things. And it was really, really limiting her to her quality of life. And so she came in to see me. And in the first treatment, going through a lot of things, we found, I pretty much figured what muscle compartments needed to be looked at. And we actually were able to target pretty quickly in that first treatment where really her main problem was coming from. And so after that treatment, and also giving her a corrective exercise program, and she's very, very good at following things up like that, very simple range of motion movements to re-educate the muscle, because that's an important part of it. So we went and did that, and then she came in to see me about 4 days later for a follow-up appointment.
I think it was the following week.
Yeah, and you came in for that one appointment, but you were feeling quite good.
Oh my gosh! After that first treatment, the next day I felt great. And first of all, let me say first of all, Annie was so good about explaining to me what was wrong, what she was going to do, and just the steps that would take to get me to where I wanted to be. And the exercises she gave me like 4 simple exercises. It wasn't, do them 10 times, 4 times a day. It was do two sets twice a day. Or
Right.
one set twice a day, I don't remember.
Right.
But there's 2 exercises that she gave me that are just simple, nothing things that if it starts barking at me, if
Right.
I just stop what I'm doing, do a couple of the exercises, I'm good to go.
Right. And so that's the importance of what Carol's doing now is we were able to get the trigger points out of those muscle compartments, and now it's her job that she's re-educating her muscles to do their range of motion that they're supposed to be doing. So now she's pretty much living her lifestyle pain-free after 3 years and is able to get out and start doing all the activities that she wants to do. And she doesn't have to, and if she runs into a little bit of a problem, if the muscle wants to tighten up a bit on her, then she can go ahead and she can do those exercises. She can re-educate. She can take the pain situation out of it, and basically continue to live a pain-free lifestyle.
And 2 appointments.
Yeah, that was
That's the best money I ever spent in my whole life.
Yeah, especially because it's your health. So I have some questions for you ladies. So I know that you were saying, Carol, that you feel like you went to a bunch of doctors and they really couldn't find the origin.
Right.
And they couldn't necessarily say this is definitively wrong or why this is happening.
All they would tell me was that I walked wrong, my feet were made wrong, my knees were made, but those are things I can't help.
Yeah, things that you couldn't change. And it
I
wasn't an
can
outlet.
change my gait. I could concentrate on walking differently.
Yeah.
Which I try to do, but it didn't make the pain go away.
Right, and I think that's part of, there's so much that the medical field can offer these days, but there's also a lot of things that they can't say definitively are right or wrong.
Exactly.
And that extra bit of help that you might not have been able to find in a clinical doctor, and he is not a clinical doctor, but that extra bit of support
Right.
and help really got you to the place you needed to be
Right,
to
and-
heal.
Exactly.
And in Carol's situation, like in so many people's situations that I deal with, is that the person is being looked at from a structural basis. They're looking at the person from their structure. They're not looking at them from function. They're not looking at what the muscle is doing. And muscle drives structure.
Right, and so function, you're saying their daily activities, habits they may have that they might not know that they have. They're looking at their physical makeup and composition as opposed to their daily practices.
Exactly. And so does she have one leg that's shorter than the other? Could be, right? Most people do. Does she hypopronate her feet? Most people do.
What does hyperpronate mean?
It's if you have your feet are flat, hyperpronation is that you tend to walk on the insides of your feet. So you're going to throw a lot of things off as far as your ankles, your knees, your hips, all the way up until you get into the neck. So if we can deal with function, which is muscle, to help to try to correct structure, then we're ahead of the game. When you're going in and you're trying to find your solution and they either can't come up with the answer to it, or they're putting what I like to say, they're putting the cart before the horse. Okay? Take muscle out of the equation, and most of the time you are going to clear the problem. And in Carol's situation, it was very, very clear when I was working on her, and lucky for her, it was very, very quick. I mean, I do have clients that respond very quickly like Carol does, but then I do have people that do come in that have been in pain for over 10 years. And it takes me, a month or so to be able to get them out of their situation. But then once they finally realize what has driven them into this situation, then now they know what needs to be done, because most people going through the aging process, when they start to have pain, they start thinking, this is something serious, right?
Or
this is
I'm looking
normal.
towards a hip replacement, I'm looking towards a knee replacement, I'm looking
or
towards...
this is just the way I'm going to have to live the rest
Yeah,
of my
or
life.
it's the aging process.
Right, and what's your quality going to be?
Yeah.
I think that's another thing that you talk to me about all the time, Annie, is that aging doesn't have to be so degenerative.
No, not at all.
It doesn't have to be a painful process. I mean, there are things that are naturally going to happen to the body, but there's a way to age with ease and comfort, as opposed to thinking that discomfort is part of the age, a mandatory part of the aging process.
Right, and it's not. It's absolutely not. If people that come in to see me, it's an important part of the educational process of getting them out of pain, is getting them to understand why they got into pain in the first place.
Right.
And actually, muscle is pretty simple stuff.
Right.
It's pretty wonderful stuff. And if more people understood how wonderful it is and what it's willing to do for us, then a lot more people would be walking around in pain-free.
And when you say muscle is simple, I know you talk about this all the time as far as it does two things. It expands and contracts.
That's what it
right?
does. Muscle does two things. It expands and it contracts. And when it gets into trouble, it protects the body and it goes into what's called sustained contraction. So it's going to hold that contraction. And in the situation of her left hip, she was in a lot of sustained contraction, and all we had to do was go in and just re-educate those muscles to open up, take the trigger points out. That was my job. And then I handed the other half of the job over to Carol. She was more than willing to take that project on. She'd been in pain for 3 years. She was in pain daily. It was breaking her sleep cycle. It was when you called me and told me that you had no pain, you said to me you forgot what it was like to live pain-free.
I did. I got up that day, and the first day that I had no pain all day, I cried myself to sleep that night. Because I was so happy that I made it through one whole day with no pain. It didn't bark at me, nothing. I had
That's
one whole
amazing.
day.
And
then I had
that's
two
what,
whole days.
yeah,
So
and
that's what
people are living like on a daily basis. And so what's truly their quality? You know, they have to sit there and say, you know, their doctor's not giving them any hope that they're going to get rid of this unless it's going to be medications, injections, or surgical. And I have to say, I'm in my 28th year of myotherapy, and I've worked on thousands and thousands of people, and Carol just makes my day, as many of my clients do.
Yeah, and something else that's really important is that, and that I really respect you for, Annie, is that you tell someone honestly during their first consult if you can and cannot actually help them. If you can't help them, you tell them, you know, I don't want to touch you, I can't do this, or this is too sensitive. But if you can help them, you offer that, you know, option to them honestly. You don't say, oh, this is a situation where I might be able to help. It's either you can or you can't, and you're going to do your very best to try if you're able to.
Well, certainly, when you're dealing with a situation with somebody coming in pain, you have to take into you have to think about, is there a more serious pathological thing that's going on here? If I'm not able to get rid of somebody's pain, I'm certainly going to steer them back to their physician. And I had a gentleman about 4 months ago that was seeing me, a young guy in his late 30s. And I was able to relieve him of a lot of his pain, but I still couldn't get rid of it. It would keep coming back. And I said, I want you to get an MRI from your orthopedic. Well, they went to the orthopedic, and the orthopedic said, well, your pain's not referring anywhere, so it's not warranted. And he came back to me, and he told me that, and I said, you have to insist on an MRI. And he did. He went back, he insisted on an MRI, he pushed on it, and they MRI'd him, and they found pathology that they needed to correct. And so I knew that there was an issue because I was taking as much of the muscle issue out of it, but I couldn't get rid of his pain completely. That's a light that turns on that needs to be addressed. Mm-hmm. In the situation with Carol, she's a very active woman, and active people are going to have sprains, they're going to have strains, their muscles are going to tighten up on them, and they need to be taught the importance of what they can do to take care of it. Now she knows how to take care of it, so now, besides getting rid of the pain, you feel more confident.
Well, you know, I really get sick of hearing, well, at your age, you know, you should expect such and such. I get tired of hearing that. Or, you know, Carol, you really should slow down. You're getting old, you're not getting any younger. I don't need to hear that.
Yeah, you don't.
She doesn't want to hear it, and she shouldn't have to.
I wouldn't want to.
And like I don't know, like 2 days after the last time I saw you, I went up to visit friends in Montana. They had a log home, 2-story, and they're getting ready to put it on the market. I told them I'd come up and help them, whatever projects they needed. The first thing we did for 2 days, I was up and down ladders to dust all the logs on the inside of the house, which I told them
It's big.
had they sent me an instructional video, I probably never would have showed up. Then we had a day off. Then for 3 days, we replaced poles in their corral fence. Not once did I have any problems with my hip. So that told me that it was under control. I can go back to the gym.
Right.
Because I was afraid to go to the gym to see, I was afraid it would start something bad again, and I didn't want to go backwards.
No, and a lot of people, and that's through the educational process of myotherapy. I did have a client today who sprained her ankle about 4 weeks ago.
Oh,
and so she said the same thing. She goes, can I start working out at the gym now? And I said, well, how do you feel? Well, I feel a little stiff. Well, go to the gym and try it out. Feel confident about doing it. And I said the same thing to Carol. Carol, are you feeling good? Yeah, go and see what your body's going to tell you. And if you have any issues at all, just call me, and I'd be happy to go over it with you. But it's building that confidence and getting them to understand that, yeah, they are okay, because they've been told for so long they're not.
Right.
And I'm telling them, you are.
And it's about being gentle with that process and that learning and education, because you don't want to go all in the first time, but you want, like you're saying, test and see what your body's telling you.
Test the waters. Sure, test your muscle. See what your muscle's going to tell you. Your muscle is very good at telling you whether it can go to full range of motion or what it can do. That's the wonderful thing about this incredible body that we have. And one of the things that we have there is our pain mechanism. And the pain mechanism is there to tell us to, hello, let's kind of listen to this a little bit, okay? So we take it to the next step, and we take it to the next step. And Carol has gone through all of her steps. She's ready. She's at the gym. She's been full activity. She's doing all the things that she wants to do.
So Carol, why don't you talk us through what it looked like coming in to see Annie for the first time? And maybe you guys can talk about that shared experience, because I know a lot of our people watching this are really curious as to what a first appointment with Annie looks like.
Well, I'll tell you, I didn't know what to expect at all. But Annie was so straightforward and so kind and gentle, as well, gentle as far as her speech, but that she explained to me what was going to happen. She went through all the steps of what she was going to look for, what was going to happen, on and on. And then she started the treatment, which was, she uses her forearms and her elbows. And, there were, quite honestly, there were a couple of times when she must have hit exactly on the right target, because I wanted to scream from my mama.
But
she was saying that to me when she was on the table. I have people that talk to me about that. And the first treatment is, it's always interesting to get people to sort of understand that it's a little bit on the discomforting side, but we want you to always be able to comfortably breathe through it. But, it took you a while to get into this pain situation, and you've been dealing with it for a long time. And by the time Carol had gotten to me, it was embedded in her nervous system. And so you have to do a little bit of work to get through that.
Like a deep tissue massage in a way. It hurts a little bit, but it needs to work it out.
Exactly. And of course, as soon as she moved her arm or whatever she was using, it would be fine.
Yeah.
It's like going to the dentist with no Novocaine. As soon as it starts to hurt so that you can't stand it, they're done.
Right.
So, and a lot of my clients, when they're experiencing the first treatment, I even had a man come in the other day, and he said, I may come off your table. I don't know how much pain I can handle. But the way that I go about working to get the trigger point out, he comfortably got through the appointment, as everybody does. Sure. And actually, when they come back, it's almost like they look forward to it. I have people actually fall asleep when they're on my table.
Yeah, I know I fall asleep on the table.
You do.
So let's just wrap this up a little bit really quickly, and I just wanted to kind of come full circle and say, so a treatment with Annie, you come in, she kind of tells you, looks you over, tests some ranges of motion, listens to what your history is, asks you some poignant questions to kind of understand your background. She'll have you fill out the form, her intake form, which gives her a lot more of your history and your medical history, so she can kind of understand causation and what the result of what's been happening is, and then she can treat things at the source. And she starts by treating your muscles, and she kind of goes through it, uses her elbow, like you said, and her forearm and her fingertips to kind of get some trigger points going and to relax certain muscles in the hopes that after a few treatments, you're alleviated from chronic pain.
Exactly.
Okay.
And by the way, her form that you fill out is not one of those 15-page forms. You know, it's very straightforward.
Well, when I am doing the history with the client, I'm getting a lot out of them. I'm also looking at how they're sitting. I'm also looking at when they're standing. I'm looking at them. I do an orthopedic assessment and a physiological load assessment on them, and they don't even really know that I'm doing that. I want to look at them. Most people that come into me are structurally imbalanced, even if have gone in for a chiropractic adjustment, because chiropractic does good work, but if they've got a lot of tight muscles, that imbalance is still going to be there. So with some of the chiropractors I work with, they like their patients to come in and see me first before they go and see them, because then their adjustments hold much longer. So it's not the end all, but as far as muscle therapy is concerned, I've never seen anything work better than the Bonnie Pruden method of myotherapy.
Yeah, and I can say that in my search for muscular healing, you have been my biggest support in that. And I've seen therapists and chiropractors and acupuncturists and different types of naturopaths, and you've been a huge ally of mine in that capacity. So I would agree with you from my perspective as well. So we're going to go ahead and thank Carol for joining us today.
Yeah, Carol, thanks for coming
Well,
by.
thanks for having me.
Yeah.
My only regret is that I didn't know about you when my friend was visiting from out of town.
Well,
because
when
she has an issue, and I said,
I get that a lot.
too bad.
The gentleman that came in to see me the other day, he said, my wife needs to see you. I have 2 employees that need to come see you. I have to, and that's what typically happens
My
with
whole
me.
family
Oh, sure.
sees you.
The
all my
whole
friends.
family, her whole family sees me, and Erica's getting her mom and dad to come in. And if you go into my charts, you'll see when you get to like McClure, like say that name, you'll go through it and there'll be a McClure, a McClure, a McClure, a McClure.
Oh,
Because the first McClure came in and sent the rest of the McClures to come in to see me. So that's typically a
great.
lot.
I took extra cards.
Yeah.
I think I only have 1 left.
So we thank you so much, Carol and Annie. And
You're welcome.
we will hopefully be talking on our YouTube next week.
Okay, great.
See you ladies
Thanks.
then.